Back to Dr. Noah's YouTube update, and this is now June 11th, I think it is, yeah. And in this article here from, let's see, Journal of Nutrition, Health and Aging, June 2011, and actually comes from Sydney, down under, University of Sydney. In terms of elderly, as we get older, we know that basically different types of systems don't work. Nutrition is a big factor. In this study, they really kind of go into the real severe type of, malnutrition that actually occurs. Now, when I went to school back 30, 40 years ago, malnutrition was kind of poo-poo that only happened in third world countries like scurvy and beriberi and rickets. But now they're finding out that people are having definitely these type of problems as they get older. And in this particular type of study where they're looking at a geriatric rehab center, they were able to show that this was a big concern. The study indicates a high risk of vitamin deficiencies in elderly and suggests that deficiencies of B6, B12 are associated with the longer they stay in these rehab centers, the more they have a problem like that. First one.
Good.
The next one is omega-3 polyunsaturated fatty acids and atrial fibrillation. Kind of a problem that I see more and more. It has a lot to do with some more minerals, but that's where your heart kind of races and starts to get out of control, doesn't work real well, and usually requires emergency room type of procedure. Lots of drugs and stuff like this. And in this article here from, once again, Melbourne down in Australia, published in American Journal of Cardiology, June 2011, showing that in this randomized control study is that using essential fatty acid fish oils are able to once again help people with these particular type of problems without using very, very costly and very dangerous type of drugs like that. I was just a little off the topic like that. They were talking about a new cancer drug. It's $60,000 for a treatment, but unfortunately it doesn't extend life expectancy. So the drug doctors give these things, charge everybody $50,000, $60,000, and you still die the same day if you didn't have it. So these high-cost type of medications are really breaking the bank of the United States, and so using natural things like fish oils are very, very effective. So. L-carnitine benefits persons with autism. Now, autism has just been exploding. There's been investigations, that used to be 1 in 300, now it's like 1 in 115, I've seen 1 in 80 children will have autism, which is a behavioral, neurological type of disturbance where the children, once again, have a hard time concentrating to severe where they're completely disabled. And in this article here from, where is it from? Medical Science Monitor, June 2011, showed that in using a randomized control study, once again, kind of the gold standard in terms of drugs, showing that L-carnitine, which is a non-essential amino acid, is very beneficial in terms of helping these treat these type of problems. They were able to find positive changes in muscle strength, cognitive scores, that's how you think, in terms of very, very, very quick amount like that, using about 50 milligrams per kilogram body weight. And so they were actually very excited about having subsequent follow-up studies about this because there's really no drugs out there, and this is a very, very devastating type of problem, autism. So another helpful and hopeful type of natural product that it works real well. One of my favorite compounds, and we'll talk a little bit later on in protein, turmeric, curcumin, that spice that you use in Indian food here. Turmeric supplementation in individuals with type 2 diabetic neuropathy. Now, we've already talked about, and actually was kind of a funny thing. I was asked to give some donations to raise money for type 2 diabetes, and so I gave a whole package. Well, type 2 diabetes is curable, so why are we raising all this money for? But once again, it's a business, makes lots of people lots of money. People, that's the #1 reason for blindness, increases heart and strokes by 250%, #1 reason for amputation, and it's completely positively curable. And that's unfortunate. But people want to pretend the drug doctors are making lots of money. But anyway, in this particular type of study here is that people that don't go the lifestyle change is that peripheral neuropathy is where your nerves start to die. And that starts to cause all kinds of problems in terms of burning sensation, usually in your feet. Well, in this study here from Iran, actually, kind of interesting, Journal of Urology and Nephrology, May 2011, another randomized double-blind placebo study showing that these patients, once again, drugs are very, very expensive. Most of the drugs don't work for the neuropathy like that. Taking a 500 milligram capsule 3 times a day was shown, once again, very, very beneficial effects in terms of helping the neuropathy, which is very, very devastating to an individual. Think of it like having acid and burning going on your feet 24/7 like that. Very difficult. Now, once again, this is just using it more as a allopathic way, using turmeric versus actually curing the problem, which is, as we've talked about before. And we've talked about irritable bowel syndrome. Check my YouTube, Dr. Noah, IBS, young guy in his 20s. Once again, treated for 2 years, tens of thousands of dollars for IBS, just got, once again, no benefit like that. And within a couple weeks, he was starting to get better, and now he's pretty much cured. But anyway, in this particular type of study here from Norway, Nutrition Research, May 2011, low intake of B6 associated with irritable bowel syndrome. Holistic and functional medicine doctors, we look at the body differently. I don't care if you have cancer, heart attack, strokes, IBS, hay fever, whatever like that. We look at the body as a whole. We get you healthy, and then the body starts to take care of whatever the quote, the diagnosis, or the ICD-9 or the ICD-10 codes are. Those are, once again, nice little labels to have a particular type of problem, and the drug gives you a drug, and then they're able to then send that to the insurance or to the government, and then they get paid. It's just a game. You want to just be healthy, just like with that study we were talking about before about this new cancer drug, $50,000 per treatment, and it doesn't make you live any longer. I mean, that's what you want. What do you want to do? If you have cancer, you want to live longer. You don't want to just go through hocus pocus. Well, same as with health or IBS. You want to feel better. So in this study here, they showed that using different types of B complex, which has a lot to do with energy and stress like that, this is their quote, a significant inverse, which means the opposite. The more B vitamins you have, the less the IBS went away. Associated between intake of B6 and severity of IBS symptoms might have on clinical implications. Now keep in mind, these are drug doctors. This isn't some natural food store. This isn't your vitamin shop. This isn't someone's kitchen in the backyard like that. These are, once again, peer-reviewed medical journals from drug doctors, and they're blown away from these natural things. The tragedy is that how come when you go see your drug doctor, they don't talk about this? This is in their journals. This isn't like, and they should give you an option. Okay, Mary or Cindy, you have a choice. IBS, you can do the natural approach like Dr. Noah, or you can do all these drugs. And that's the problem. If people had a choice, they would never go with the drugs. The drug companies wouldn't make billions and trillions of dollars. The drug doctors would be out of business, and that's why it doesn't happen. So you have to understand what's the purpose here. If you want to be healthy, you have to be looking for healthy solutions.